Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It really does help us. And please leave us a comment. We want to hear from you. I'm your host, plastic surgeon Dr. Bruce Herman, and with me, as always, is the wonderful Sarah in a very fetching outfit, I must say. I do like it. It looks pretty good.
Yeah, we were talking about my print.
Houndstooth. Yeah. No, that's really good. Travis in the box, you got a houndstooth jacket on in there?
I do not. I have some regular like 90 stripes. I guess you
I do like 90 stripes though. It looks sharp,
That's
man.
about it.
Yeah, very
And
good.
my helper in the back.
I see you got a helper back there. The intern today?
Yeah, taking the TikToks.
All right, nice. Well, everybody having a good week? Anything exciting happening?
I'm taking Avery to two things this weekend.
Oh, tell me.
So today I'm going to take her to the Harry Potter experience in Little Elm.
Is she a big Harry Potter fan?
I don't know, but I am.
Oh. So you're going to go do something.
She's watched like the first two movies, which are the most appropriate for her age.
Right. Yeah.
Because after that, it starts getting
dark.
It gets dark and it's just, they're long.
Yeah.
Yeah, so she liked the first movie for sure.
Oh, then she'll
So
love it.
yeah, she likes all that
and
stuff.
That's around here somewhere?
It's in Little Elm,
Little Elm,
around
nice.
Louisville.
Cool.
And then and then on Saturday I'm taking her and my mom to go see the Nutcracker in Dallas.
Oh, fun. That'll be cool.
Yeah.
Awesome. Wow, you got a big weekend.
I love going to see the Nutcracker. I was in the Nutcracker when I was in college.
Oh, were you in?
I was an acrobat.
Were you?
Yeah,
Wow.
I dressed up like a Russian man.
Oh my
I had
gosh.
a beard and a hat,
can't
and
see
I
you
would
with
just
a
sit.
beard.
I was literally the whole time doing back handsprings and straddle jumps for like 2 minutes. It like I don't know how I did it. I was in such better shape.
Wow.
Thinking
Yeah.
about doing that now, I'd vomit.
You had the strongest arms in like 4th grade.
Yeah.
The strongest 4th grader out there.
I was not in 4th grade. I was in college,
Oh, never mind. I thought this was like school.
and I got paid
You got paid to do it?
$100 a show. It was a professional
Wow.
They flew in.
You're like a professional thespian.
I know they flew in Russian ballerinas and everything.
Jeez, wow.
It was serious.
In college, $100 go a long way.
Yeah,
it sure
I was
does.
like, I am buying so
You're
much
like,
stuff.
I'm rich.
I know, it's on me.
Awesome. Well, I'm gonna have to get a full report on those things.
Yeah,
That sounds like
it's
a
gonna be
pretty,
fun.
pretty big weekend.
Yeah.
So
What about
I
you?
did the marathon thing last weekend.
Yeah, you did. I saw it.
It did good. Like I was really happy. I was a little nervous because I had to run like an 8-mile segment.
Yeah.
And I'd only been training at 4 miles. I was hoping to get like 9 minutes per mile because I've been running like 8 minutes per mile roughly with 4 miles.
Mm-hmm.
So I was like, oh, if I double that, maybe if I slow down to 9. But I actually ran 8:27 per mile.
Oh, at what lap or what mile were you like, oh my gosh, I gotta slow down?
I was actually running closer to 8 minutes per mile up until the 7th mile.
Okay.
And then two things happened. One, like my body's like, what are you doing? Like, this is not how far we run. And then two, we hit this big hill. And so the last mile killed me. But I'd done so good in the first 7 that my time still was pretty good. Like, I mean, I was kind of hoping I might get below 8:30, and so I got 8:27, which is below it. And I was like, yeah, nice.
I would have been solid 10 to 11 minute mile if I was running.
My team did like right at 10 minutes per mile. Like all of them were kind of right about the same. But yeah, I was really happy with that. It's fun. I used to do a lot of races like that, like 5K, 10Ks, half marathons. And you just kind of get out of it, you get busy and stuff. And I think I'm gonna get back into it because I really enjoyed the competitiveness, because I mean, you're running against a million people, but trying to get ahead of the next person and not let somebody, I just kind of enjoy that being a runner, so.
I think Denton has a lot of little running things.
I think I'm gonna sign up for something in the spring because that'll keep me going.
A goal, yeah.
Yeah, if I have something I'm, trying to train for, I'm pretty consistent about getting out there, so.
Yeah.
Where was the course? Like,
so it started right at downtown, like in Main Street, Dallas, and then it went out to White Rock Lake and around the lake and came back. And so I had my run, I started at White Rock Lake and then ran all the way back to downtown.
nice. Wow,
Yeah.
that's a good distance too.
Yeah, it was a while, but no, it was fun. And it's kind of cool because they have like DJs like every half mile, like spinning tracks, and there's people. I don't know where these people come from. There's people out. I guess their family members are running or something. My wife is like, I'm not coming out there, right? I'm like, no, I don't expect you to come out and like cheer at the finish line or anything. But no, it was good. I was really, really happy, and but I was like sore all week because I ran much harder than I normally do.
Yeah, I would have been super sore.
Yeah, like I just like even today, like when I was like bending down to get some, I was like, oh, yep, still a bit sore. I haven't run since then, but I'm gonna get back into it this weekend. But. So anyway, yeah, that was cool. Like, so I was pretty
Well, the
happy.
last segment, I'll have some tips for you.
Yeah, I'm interested to hear. Now that I'm kind of back into the running thing. So, all right, well, let's jump into some segments. I know you've already heard about this story.
Yeah.
So Amanda Bynes was
Poor
on
girl.
social media this week talking about having plastic surgery, and she was actually talking about having a blepharoplasty, which is eyelid surgery. And so she did a little video, which I thought we'd play it because I'm always interested to hear what people think about plastic surgery.
The video is kind of funny to watch because she sounds so like monotoned and
She does, right? Yeah, I would agree with that. So,
and like I don't know, it's just kind of silly.
It's a little off, but anyway, all right, Travis, roll that video, will you?
So I saw a couple of stories online that say I have a new look, and I was never open about this before, but I actually had blepharoplasty surgery on the skin folds in the corners of my eyes. So I don't have those skin folds anymore. It was one of the best things I could have ever done for my self-confidence, and it made me feel a lot better in my skin. So I just wanted to post about that just to clear up that rumor as to why I have a new look. I feel a lot better now about myself, and I'm so glad I had the blepharoplasty surgery. It was one of the greatest things I could have ever done.
Alrighty, so a little bit to unpack there. Those eyebrows are really blue. It kind of was distracting me a little bit. But no, she seems
is a
like
distracting gal.
Yeah, she seems like she's really, really happy with her surgery, which is great. It was a great experience for her, and I mean, I'll kind of go into her results in a minute, but yeah, so when I saw this story hit, I was like, wait, I think she's really young, and so she's 37.
Yeah, she's my age, or around my age. Like, I remember watching her grow up as I was growing up.
Yeah, she was a child actor, yeah.
Yeah.
So the first thing I thought is, wow, she's really young to get a blepharoplasty. And then I thought, well, did she even really need it? Because I mean,
it's just it just makes her eyelids look like more space, I guess, like opens
so
her eyes
it was
up.
actually her bottom ones. So I actually went back like through the last decade and got some pictures of her for before, because I wanted to see, because that's obviously after. I wanted to see the before and did she really need it? So Travis, throw up that next picture, will you? So this is all her, obviously, in different times throughout the last decade, and you can see that her lower eyelids do have quite a bit of wrinkling in almost every single picture, which for someone in her age bracket, which in these pictures she's anywhere from like late 20s to early 30s, it's pretty unusual to have that much redundancy of lower eyelid skin. I mean, it almost stands out a little bit. I saw the picture, I was like, oh wow, she really does have that. And so I want to compare that to her after picture. Travis, throw up that next one. So you see here in this picture, I mean, she looks a lot different with the hair and the face tattoo and all that, but her eyelids look really, really nice. Like they're nice and smooth. There's no redundancy of the skin. And so,
The bottom, right?
The bottoms, correct.
Yes.
Yeah, the bottom. We were looking at the bottoms. Did you see the bottoms before?
Yeah.
How they had like those lines, or it almost makes you look tired.
Yeah.
So yeah, she really did have a notable amount of lower eyelid skin, and she got a very, very nice result from it. And then I started wondering.
I know 2 guys that have gotten that done.
You do know some people? Yeah.
2, and men. I think men get it a lot, right?
They can, yeah, they do, yeah,
Okay.
for sure. Not all the time, but they do. So I started wondering, for her to have that, because most of the people I do blepharoplasties on are at least like 50, and she's 13 years younger than that. So I actually found a picture of her and her parents. So throw that next picture up, Travis. So you can see in the picture, like both her parents do have redundancy in their eyelids, and that's why she has it so young. Both of her parents have notable amounts of what we call blepharoptosis, which is basically the doctor word for redundancy of eyelid skin. And so, that's how she came to have it at such a young age. So I don't think we've ever talked about eyelid surgery that much, have we?
I think we've talked about it before.
We have done a whole segment on it?
No.
I don't think so.
I think we've just talked about it.
Just like glossed over it. So I wanted to spend the rest of the segment just kind of going over blepharoplasty, which is, once again, the word for a eyelid lift. And it is a surgery I do. I don't go out there and push to get blepharoplasties. I mostly do breast and body stuff. But eyelid surgery is not overly complicated in most cases, so I'm happy to still do them. It can be done on the lower or the upper eyelids. In fact, I do much more upper eyelids than I do lowers.
Yeah, for people who have like hooded eyes.
Yes,
Mine
exactly.
are kind of hooded. Like mine, I don't know.
I mean, it's not.
There's more people. There's other people
Yeah.
with like more.
Right, and it can get
yeah.
so redundant that eyelid skin can start to bunch up and then hang over your eyelashes, and it actually can start to decrease your vision.
Yeah, because you're like just not opening your eyes as wide, probably. Just like.
Well, it pushes your eyelids down a little bit, and
Yeah.
also the extra skin actually will come over the eyelash and start to block your peripheral vision, so that your peripheral vision, which should be
like getting
pretty
tunnel.
wide, it starts to tunnel, like both from the sides and the top. And so, yeah, I mean, in fact, when I first started practice, we were doing a fair number of blepharoplasties under insurance, because insurance would sometimes pay to remove that extra skin because it was affecting people's vision. But of course, like everything, it got abused, and so there were plastic surgeons out there doing cosmetic blepharoplasties to make people look more
Yeah.
youthful under insurance. Insurance caught wind of it, and suddenly it got really, really hard to get these covered, to the point that it's almost not feasible to get them covered by insurance anymore, which kind of sucks. So they are a fairly quick procedure. It takes me about 30 minutes per eye to do these. And I said you can do these for both functional or cosmetic reasons, or both. For cosmetics, it's done like Amanda Bynes did, to make them look more youthful.
How does she not have like visible like scars and stuff? Like how does that happen?
Yeah, that's a great question. So
that's like on your
when
face.
you do these surgeries, like if you're doing them on the bottom, the incision is literally like 1 millimeter away from your lash line. So it just blends right in with the kind of edge of your eyelid.
Crazy.
Yeah, and then if you do them on top, you put the incision right in the crease, the natural crease of your eyelid, where it folds when you blink, or when your eyes are open. And so, yeah, blepharoplasty scars across the board should be invisible. I mean, that's like the expectation, is that these are.
Do people ever get both up the top?
Sometimes,
and
yeah,
bottom?
you can.
Okay.
Yeah, you can do both. In fact, I was supposed to do a double just recently, a month ago, and then the patient ended up getting COVID or something. I had to reschedule. But yeah, you can absolutely do both. And so what the surgery does is, the main thing that the surgery wants to accomplish is it wants to take out the extra skin. The skin's either the functional problem in that it's blocking their vision, or it's making them look tired. And actually, I have one last picture. Throw that picture up, Travis. This is the pattern that you draw when you're about to take off the excess skin, and that little kind of trapezoidal shaped pattern would be the skin that would be removed, and that pattern is created by basically measuring the number of millimeters away from certain landmarks. So like the corner of the eye, the lash line, your eyebrow, and then also how much skin you could kind of pinch. And so, yeah, you basically, that's half the work, is just drawing the pattern appropriately. And then you excise that piece of skin. There's a little thin layer of muscle underneath that goes as well. The other things that the surgery can do is, if people have like an excess of fatty tissue that causes their eyelids to be really, really puffy, that's not skin redundancy, then you can change that. That's oftentimes more on the lower than the upper, but it can be, it can be both, or a lot of people don't need that. And then lastly, one of the things that an eyelid surgery can do is affect the laxity. So as we get older, and Amanda didn't have this for sure, but as you get older, the lower eyelid starts to kind of hang off the globe of the eyeball, which makes the eyes look a little bit more aged. And so that's the other thing that you can do. So I do these under anesthesia. I mean, it's theoretically possible you could do this under local, but I would never do that. I just don't feel comfortable someone being awake when I have a scalpel and needles around their eye. Like, I want them knocked out.
I wouldn't feel comfortable.
I know people have done these under local, and this is one of those surgeries where it's easy to get the numbing, but it's just the uncomfortable kind of sensation of someone working around your eye.
Yeah.
So I really am not into that. As far as the recovery goes, it's really not a painful operation, because it's just really taking away skin for the most part. But the problem is that when you operate on the eyelid, it swells. Like, the eyelid does not like to be messed with, and so when you operate on it, it like swells up, which is not a huge problem, except that oftentimes then the eyes won't shut properly, and so you'll end up with like little cracks in your eyelid, which then cause your eyes to dry out. So most of the recovery is just putting eye drops in your eyes and ointment at night to keep your eyes lubricated so you don't get like a corneal scratch from being too dry, and then just waiting for the swelling to go down.
Okay.
So pretty easy recovery outside of the swelling. The instructions are pretty simple. Like we have people put cool compresses on. We'll have them keep their head up just to keep the swelling down. We'll have them put drops in their eyes. As with the scars, which I was going to talk about, you already kind of outlined that the scars really are not visible. Now, right off the bat, they will be. Like when you do these, obviously the incision is going to be visible in the first few weeks to like a month or so. But really, they do fade away very, very quickly, and they just blend in with the natural creases of the eye to the point that you really shouldn't be able to tell if someone's had a blepharoplasty.
So you're like ready to go for a close-up in like a month or two?
Yeah, probably a couple months. Yeah,
okay.
Probably a couple months. Complications, overall, very, very low with this surgery. I mean, I've done a ton of blepharoplasties over the year. I don't think I've ever had to take anyone back to surgery for any reason. I mean, as long as you can, know how to draw out the pattern and, keep out of trouble by not banging into like some of the more critical eye structures that are deeper. I mean, these are pretty straightforward to do. You definitely want to make sure that if you're going to have one of these, that you go to a surgeon that's comfortable doing them. You definitely want either a plastic surgeon or oculoplastics or someone in that type of field, because if you get like down too deep or you don't do a clean dissection, you can get scarring, and then the eyelid will scar, and then the eyelid won't seat properly, and you can potentially have some bad complications from these. But in the hands of people who are comfortable doing them, they are pretty smooth.
Yeah.
So
I feel like since your eyes are, one of your five senses, you should be pretty.
You do want to be careful. Yeah, you wouldn't want to like go get this done like in the back alley, like in a van, like discount.
No, down by the river. No.
Yeah, down by the river. So, and talking about cost, like I said, it's hard to get insurance to cover these anymore. It's not impossible, but close to it. If you're going to pay out of pocket, you're probably looking at $4,000 to $5,000, which is maybe a little bit less than a lot of plastic surgeries. Because they're just shorter on time and there's like no implants or anything. So they're not like too cost prohibitive. But yeah, so I just want to do like a quick 1 minute recap on this. So Travis, come on, zoom in here. We're gonna get real. So Amanda Bynes, 37-year-old actor, went on social media this week to talk about her eyelid surgery. She had a blepharoplasty, which is removal of the eyelid skin. This is a surgery that is pretty simple to do. It's very, very popular, one of the most popular plastic surgeries. Overall has a pretty easy recovery, low complication rate. She did it because she had kind of a genetic predisposition to excess eyelid skin. She got a great result. She's very happy. The cost of this is about $4,000 to $5,000. So that's the recap on Amanda Bynes and her eyelid surgery. So